What you're about to see isn't science fiction. It's the leading edge of a brand new era in medicine, one where AI doesn't just analyze information, it acts on it. In this explainer, we're going to map out exactly what this autonomous future of healthcare really looks like. Take a look at this. Right here, an AI agent is compounding sterile medications. This is a task that requires incredible precision, and it's doing it autonomously. It's a preview of a system that's getting exponentially faster. I mean, this is all about crushing the delays that can put patients at risk. It's about getting critical treatments ready and delivered with a speed that, let's be honest, humans just can't match 24/7. Now, let's pivot to what is basically the hospital's central nervous system, scheduling. You know, trying to juggle surgeons, operating rooms, and high-tech imaging machines, it is a logistical nightmare. But an AI agent, it can see the entire chessboard at once, optimizing thousands of moving parts in real time to make the whole hospital run smarter. And look, this is way beyond just avoiding double bookings. This is about predictive power. It's about the system knowing that an incoming ER surgery is going to create a traffic jam for recovery beds 3 hours from now, and it starts rerouting resources before it's a full-blown crisis. And this intelligence, this isn't just locked away in some server room. It actually extends all the way to you, the patient. Think about an app on your phone that doesn't just ping you to take your meds, but it actually knows you missed a dose and gently asks if you need help. It makes the whole experience feel seamlessly connected. It's about forging this constant, supportive link between you and your care team, making sure that help and guidance are always there, right in your pocket, long after you've walked out of the hospital doors. Faster, smarter, and more connected. You know, when you start layering these things on top of each other, you're not just tweaking the old system anymore. You are building something totally new. Healthcare's autonomous future, where these intelligent systems become proactive partners in our health. So, what is the engine that's driving this whole revolution? Well, it's a specific kind of artificial intelligence, and it's called Agentic AI. And you have to understand, this is a huge leap from the kind of AI most of us are used to. It moves AI from just being a passive analyst to an active participant. At its heart, Agentic AI runs on a really simple but really powerful loop. First, it perceives. It scans a patient's latest lab results, it checks hospital bed status, it sees an ambulance report. Then it plans. It sets a goal like, okay, we need to prepare for a critical cardiac patient, and it maps out a strategy. And then, and this is the game changer, it acts. It autonomously reserves the cardiac lab, it pages the right doctor, and it puts the necessary medications into the pharmacy queue. And that action, that's everything. A predictive AI, the kind we have now, might flag that a patient is at high risk of being readmitted to the hospital. An agentic AI does that too. But then it also schedules the telehealth follow-up, orders the at-home monitoring kit, and sends educational videos to the patient's phone. See the difference? It doesn't just give you an insight, it goes and executes the solution. Now, this isn't just one giant AI brain running the whole show. It's much better to think of it as a highly specialized team, almost like a surgical team. This whole ecosystem is made up of 6 core types of agents, and each one has a very specific job. So let's start right at the heart of the hospital. On one side, you have the clinical agents, and they're focused directly on patient care. And on the other, you've got the operational agents, and their job is to make the hospital itself run like a well-oiled machine. So a clinical agent might be helping a doctor by analyzing a CT scan for things the human eye might miss, or taking a patient's entire, complicated medical history and turning it into a perfect one-page summary. And while that's happening, the operational agent is the master logistician, making sure that when that doctor needs an ICU bed, one is already clean, staffed, and waiting. All right. Next up are the agents that tackle 2 of the biggest headaches in the entire system, all that endless paperwork, and the often really confusing and stressful patient journey. The administrative agent is really the unsung hero here, humming away in the background, automating the soul-crushing work of insurance pre-authorizations and medical billing. This frees up so much time for the human staff. At the same time, the patient-facing agent is like your personal health concierge, helping you understand your treatment plan and empowering you to take control of your health right from home. Okay, so for the final 2, let's zoom all the way out. These last agents aren't just looking at one patient or even one hospital. They're looking at the health of entire communities and trying to plan for the future. The public health agent is kind of like an epidemiologist on steroids. It can spot a potential flu outbreak in a single zip code just by looking at pharmacy data and what people are searching for online. And then it can launch a targeted awareness campaign. And the analytics agent? That's the grand strategist, using all of this data to predict what a community's healthcare needs will look like in 5 years, so we can build for the future instead of just constantly reacting to the present. So, we've met the whole team of 6 AI agents. But that brings us to the real question, right? So what? Why does this actually matter for the doctors, nurses, and patients on the ground every day? This quote from the research just absolutely nails it. Agentic AI acts as the connective tissue for the entire healthcare system. It closes that gap, that infamous last mile of care, between a doctor making a plan and that plan actually getting executed perfectly without any details getting lost along the way. Let's just put it right here, side by side. On the left, that's the reality for so many people today. Clinicians are totally burned out by administrative overload, vital information is stuck in different systems that don't talk to each other, and care is almost always reactive. The agentic future, on the right, is about stripping away all that logistical friction, letting clinicians focus on being clinicians, empowering patients, and flipping the entire model from reactive to proactive. But the real magic here, the true power, isn't in what any one of these agents can do by itself. The entire vision is to weave them all together into a single cohesive, intelligent system of care. This table here really visualizes that teamwork. It might look a little complex, but just look at the row for care continuity. To make sure a patient has a smooth transition from the hospital back to their home, you need the clinical agent, the operational agent, and the patient-facing agent all talking to each other and acting in perfect sync. No single agent can pull that off alone. Integration is everything. And that really is the biggest takeaway. This is not about replacing people with a bunch of task bots. It's about building a true nervous system for healthcare, an interconnected, responsive, and autonomous network that supports our amazing clinicians and wraps around the needs of every single patient. The technology is moving at a dizzying pace, and the reason we need it is crystal clear. But that leaves us with one final huge question to think about. What's the biggest barrier? Not in the software code, but in our own human willingness to trust, adopt, and integrate these powerful systems into the deeply human practice of medicine.